We're back on shift inside the ambulance.
Hello, Black Country!
Hey!
We're back!
Go, 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 go.
We're with the West Midlands Ambulance Service.
Whereabouts in your belly is a pain?
Does it look bad to you?
As they face more heart-pounding action
Okay, off chest for me.
Clear! Everyone clear!
and more medical emergencies.
Okay, we've got some good respiratory effort now.
Battling over 4,000 calls each day.
Oh, calm down, please.
Don't cry, darling.
I've had enough, you know.
Look at that.
There are some new faces
Can I wear the team shades? Pretty please.
and some old friends.
I love you, John Stevens.
No, you don't.
Yes, I do. My life has been positively dead without you.
Body-mounted cameras record every moment.
Can we come in and have a chat? Have you got a favourite teddy you want to take with you?
I'm going to need to shave you.
To show you what goes on behind closed doors.
We'll need to call security for these pair. They've been nothing but trouble.
You'll be on the front line with the ambulance crews as we take you inside the ambulance.
And off we go into the Royal Blue yonder.
Okay, let's go.
You know when you feel like you forgot something?
What do you think you forgot?
I don't know.
Got like a weird knowledge of number plates and stuff. Like you could literally tell me any number plate and I'll be able to tell you what year it was.
Average.
Still younger than me, it's an 89.
Do you know why the Queen doesn't wave with his hand?
What?
Because he's mine. That's... Honestly, that's a proper bad jokes, honestly.
Five, 7.
Car distress, please, in the street, Bristol Road, second crew on route, and a few minutes behind you.
In the West Midlands are paramedic Ben Fletcher and trainee paramedic Anna Ray. They've just been sent information about a critically ill patient.
So we've got a cardiac arrest apparently outside.
Outside?
Outside the address, yeah?
It's a Category 1, the most urgent call the team can get.
Is the police there? 5-7.
5-7, thank you. Police are on scene. Apparently the patient's been involved in an RTC. Received, Anna.
Yeah, received, thank you. Hi guys. Okay, what happened?
The 65-year-old man has stopped breathing, and the medics already with him can't find a pulse.
You carry on.
It's thought the patient suffered a major cardiac arrest while driving. Witnesses saw his van veer across a busy road, hitting a car and then crashing into a lamppost.
Keep it going. That's it.
As he's not breathing, Anna needs to force air into his lungs.
Can you stop for a second? Yeah. That's fine. Carry on. If you can count to 30, then I will be doing 2 breaths, yeah?
Well, I can ask me a second.
Okay, carry on. Carry on.
The patient's now been having CPR for around 5 minutes.
You want to back out?
You look like you're knackered, my love.
If one of you wants to take over airway, I can do the compressions. Yeah. Okay, do you want me to take over?
Just check with him, Anna. Anna, just check with him.
Okay.
The man's heart is failing.
So, okay, I'm going to charge it up.
Ben needs to try and shock it back into a normal rhythm.
When you're ready, Anna, off chest for me. Option clear. Okay, back on chest for us then. Thank you.
Just say when you want to swap out.
I'm alright for now.
You're going to do a break.
Okay.
We've got some spontaneous.
Nice, Lynn V. VF. Okay, off chest for me.
Clear. Everyone clear.
Okay, lovely, back on.
A second crew have arrived to support Ben and Anna.
You get the scoop for us
Your mate
now.
has gone to get a scoop, so we can just pop you on a stretcher.
Is everyone happy to lift as
Yeah,
it?
yeah.
Go on, lift. Ready,
Yeah.
steady, lift.
Okay. Yeah.
The longer the patient remains like this, the higher his risk of brain damage, should he survive.
Just hold for a moment.
Everyone on his airway.
Yeah.
Airway.
Get back in.
15 minutes downtime currently.
So far, there's been no real sign of improvement in his condition.
Right, that was very literally just before.
Can we get some end-tidal CO2 on him as well?
Yes.
Right, adrenaline going in there. Down there.
An adrenaline shot could help restore the man's heart rhythm. Arriving on scene is Ian, an emergency medical consultant.
What's happened?
He volunteers for the West Midlands Central Accident Resuscitation and Emergency Team, known as the CARE Team.
Just had one lot of adrenaline, 3 shots.
So, when you found him, he was in VF?
Yeah.
VF is short for ventricular fibrillation.
Do we know what time that was?
So,
in a second, mate. It'll be about 10-15 minutes.
Yeah.
10 minutes.
It means that the man's heart is beating, but it's so weak and out of rhythm that blood is not being pumped around his body.
And obviously we don't know anything about him.
no.
All right.
No medical alert bracelets.
Clear some people. Who
Yes.
do you need, please? Thank you ever so much.
Pleasure.
Once again, the team need to shock the man's heart.
Clear.
Off, go.
Okay.
Back on the chest.
Let's go up and down, let me tell you.
We have been suctioning his airway. He has been getting progressively worse with his airway. Everybody needs to listen because everyone needs to know what's happening. All right, at the next 2-minute gap, we're going to do ultrasound of the heart, see what's happening there. He's going to have some adrenaline and some amiodarone. Everyone happy? Yeah.
Yeah.
They've been giving chest compressions for just over 20 minutes.
Do you want me to take over?
I'm all right.
You all right?
Are we getting much out of there? Right, rhythm assessment. Rhythm assess. Okay. It's like sinus rhythm. Sinus rhythm. Any pulse?
I was going to say, he's making effort. He's making effort.
Yeah, he's breathing.
The best relief is when you actually get a heart rate, when you bring the patient back. It's something that you cannot describe.
Even though the patient is breathing, his condition is critical. He needs immediate hospital care.
Nice, are you ready?
Yes,
okay.
please.
Hello, it's the ambulance here. Got an alert for you. We've got adult male, unsure of age, cardiac arrest. He's not awake, but he's breathing for himself. We've got a pulse. Yeah.
We're actually getting good respirate, we're getting good CO2. We have an airway that works.
30 minutes after his cardiac arrest, the patient arrives at A&E.
Ready?
Okay.
In resus, an emergency team is waiting for him. They'll need to work quickly if they're to stabilise his condition.
That was a bit of a job.
You're telling me? We got him back, so we did.
Yes,
we did our part.
saved the life.
We did our part. That's what the job's all about, isn't it?
It makes a difference when you actually save someone's life.
Mm-hmm.
Let's just hope he can recover.
I say hopefully
Mm.
he gets sorted and we can
It
go
will
back
be
home.
nice, yeah.
Do you not think we should carry tea on the ambulance?
Do you know what? Because I've said this quite a lot, because in a crisis, what do people want?
They want a cup of tea.
They want a cup of tea. If we had a little tea and coffee machine, I'm not saying take up everything, but, you know, keep all the important stuff, all the important equipment. I'm sure we could streamline enough space.
We could, just a little
Just for
tea
a
or
small,
coffee
just
machine.
a tiny one, yeah.
And everyone would be much happier with tea.
I mean, 100%, definitely.
Paramedics Aaron Campbell and Hannah Meredith have worked together for more than 2 years.
New assignment.
Curtain. Oh, this is a little jaunt out. Got an 89-year-old female that can't stand up.
This will be their 5th patient of the day. The patient's husband, 89-year-old Sam, is waiting for the ambulance crew to arrive.
Hello.
Hello, madam.
Who are we here for?
This is the Oldham.
Hello.
Hello, Cocker.
What's your name, sweet?
My name?
Yeah.
Mary.
Mary. I'm Hannah, and this is Aaron. What's going on then? What's happened?
At the moment, she can't stand. Normally she walks on a walker to go to the toilet or in the room, but now she's tumbling down. She can't hold it. She's not eating, not drinking, and nothing like that. And they just can't get to the toilet. She is 90 in May, and I'm the only carer. I'm lost. I'm all on my own.
Okay.
Like, have you got the picture at the moment?
Yep. Sounds good to me.
Sam has been Mary's primary carer since she was diagnosed with dementia and Alzheimer's 8 years ago.
Can I pop this on your arm, Mary?
You can.
Thank you.
You got a nice face.
I have a nice face.
Nice
We'll get your eyes tested as well today, Mary,
No,
I
I
think.
don't.
You've obviously got something wrong with your eyesight, haven't you?
Don't silly.
You do well to manage yourself, don't you?
It's hard going at times.
I'm sure it is.
Sam had been looking after Mary pretty much on his own for a number of years. One of the things that we can do as an ambulance service is contact social services and see what assistance they can provide. Things like carers or adoptions around the home. Subtle things that can be really helpful for people in their sort of later years.
Look at me, I've been here 5 minutes, you've got me on my knees already.
You're proposing?
I am, yeah. I'm proposing you give me a drop of blood from your finger.
Right.
How's that? Sharp scratch.
Ow!
Sorry.
What's your name?
Aaron.
Aaron?
Yeah, like Elvis's middle name.
Oh dear, that's a nice
And you're the better half, yeah?
Where'd you get that from?
My mum?
Never.
My mum named me Aaron, yeah.
Yeah. You're stuck with it now.
Yeah, I can't get rid of it now, Mary, you're right.
Don't need to, do you?
No, it's all right, isn't
Nice,
it?
isn't
It is. Mary, do you think we can have a stand up?
No.
Yeah.
Oh dear.
You're going to take me with you?
Oh, I can't
Oh,
look.
no?
No.
What about if we pull it out a little bit like this? There we are.
Okay.
Hello. You're quite tall, you, aren't you?
Give us a kiss.
Go on, then. Mwah. Your husband's going to be slapping my face in a minute.
I don't think so. Can I go down?
Just a second. Oh.
I'm all right, you know.
Yeah? Can't find anything wrong with you?
No, thank you.
Well, we can't see any signs of infection, but it could possibly be a water infection. we can't leave her here because you can't manage, so we're going to have to take her up to New Cross.
Mary has a history of urinary infections. With her last one, she was in hospital for 3 weeks.
Thank you.
Blanket coming on.
Where are we going now?
You're going to New Cross Hospital to have a check-up and see how they are and see if you can come back home again, or they're going to give you some tablets for the night or what, something, I don't know.
You coming?
I am going to be coming here.
Okay,
Go get rid of me that quick.
Okay.
Right, get me then.
Come by, come by.
Wait.
Come by, come by.
It's
a bit of Welsh, eh, look?
It sure is, Mary. Okay. So I'll put it down there for me.
Keep going back.
Is Sam coming?
He is.
Good.
We need you on here, sweetheart.
Pull. There we go. You're all right.
You're all right.
Step up. There we go.
Beautiful.
Thank you.
You are sitting there, or you?
No, there, you there, please.
S05E01, Sam, so there's no more shoes. See you up the other side, Mary.
Okay.
The other side. You're warm enough, darling?
Yeah, not bad at all, Sam. You all right?
Well, if we're going to get you right.
How long did you say you two have been married?
67 years.
Oh, wow. You need a party, Mary.
Yeah, and we've been together since 1946.
Wow.
71 years.
Blimey.
And we met round Wolverhampton Fair.
Oh.
You was in the Land Army, I was in the Army.
Oh.
I fancied a mate though.
Oh.
I kept trying to-
Oh, she wasn't your first choice then.
You wanted
Oh,
Nelly?
Yeah,
Colin
yeah,
would.
yeah. I wouldn't like her, would I?
Nah.
Yeah, so that, we hadn't done them. We had 5 children, and I had just lost a daughter.
No, I'm sorry.
Good chance.
Love you, son.
I love you too, man.
Aww.
And off we go. Into the wild blue yonder. Alright, Cocker.
All right, Cocker.
Good.
Having tried?
Yeah, all right.
All right.
Unfortunately, Mary's dementia has been getting worse over the years.
Where are we going?
New Cross Hospital.
Oh,
You might not be stopping, but you're probably going for a checkup then.
Okay.
Yeah, we don't know yet.
and you bring me out.
We don't know yet,
Yeah.
darling. No
When
good-
you're better.
Yeah. No good coming home when I can't walk you up the stairs and get you in bed.
Okay. We'll look what another day we stop.
Of course we do, darling.
Yeah.
It is really nice to see couples like Sam and Mary, you know, well into their 80s, 90s, and still sort of almost in their 20s and 30s in their head. And the way Sam spoke about Mary as well, you could tell it was still very real. It was, you know, it was still the most important person in his life.
Oi, oi!
Okay.
You all right, Cocker?
Hey,
You all right?
I'm all right, Cocker. You all right, Cocker?
I am, Cocker. Are you?
Doesn't sound right when you
Doesn't
say
it?
it.
It's all cocky now.
Isn't it?
Mary will now have further tests to establish if she has a urine infection or if there's something else causing her to feel weaker than normal.
It's a bit nippy, isn't it?
Yeah.
I wanted to take Sam and Mary home.
They were cool, weren't they?
They were so cute together.
She wanted to take me home.
She did.
She asked.
Oh, they were lovely. Been together 71 years.
Well, some people don't even live that long.
I know.
I reckon it's just their dementia getting worse, you know.
It did cross my mind. They'll find out.
Yeah.
It's very bright outside. You're gonna get crew shades out? Team shades?
I don't. No, because you won't let me drive.
I'll let you drive on the next job, after the next job.
Oh, will
okay. Can I wear the team shades? Pretty please.
If you're not going to be a team player, you can't wear the team shades, can you?
Will you manage that then? Oh, bless you, thank you.
On the outskirts of Dudley are paramedic Steve Hill and technician Harley Mosley.
Oh, look at this. Friday evening, we're in the countryside. The thing I'm missing is a cider. That'd be better, wouldn't it?
Steve has been a registered paramedic for 6 years. Harley used to be in the army before deciding to retrain.
What would be your worst date that you've been on?
I don't think I've been on many where, like, it's gone that bad that I've really not wanted to see somebody again.
I went on a date once with a guy, right? He rocked up. It was nothing like his pictures, obviously it's internet dating, malarkey. Anyway, I texted my friend and I was like, will you like phone me or something, you know, to get me out of this date?
Will you phone me, please?
Yeah, she didn't. And then she texted me back and she went, why, what's the matter? And I text back and I said, I really don't like him. He's nothing like his pictures. I'm absolutely bored, senseless. And I sent loads of emojis. And he gave me a really funny look. I'd only text him. I was like, oops.
It's not long before an emergency call comes in.
Oh.
New assignment.
So we're going to ill chest and abdo pain, too ill for all normal activities, neck pain. What was her name again?
Amy.
19-year-old Amy lives with her parents and new baby daughter.
Oh, look at the little baby.
Hello, you all right?
Yeah. I'm
mate.
Harley. Steve's just coming. Harley.
That's my daughter's name.
Hello.
Oh, is it?
Hello,
what's
Harley.
her name?
How old's Harley?
Another female Harley.
Oh, bless her.
Oh, you've picked a good name.
Hello, mate. Hello.
What's happened this evening then?
I was not last week before and the week before that I was in hospital with gallstones and I had pain. And obviously they kept me in for 2 weeks.
Can you feel your pulse?
Which I didn't enjoy.
Just relax.
And they said that they let me out, but they said if I start feeling the pain again, or if it was in my chest especially, to come back.
Yeah,
but
yeah.
I didn't even get the chance to go to the thingy. I literally have just been sick as well. He said to watch out for the chest pain, which is there.
Yeah.
Because he said that could be something to do with the pancreas and they'd want me back in as soon as possible, really, if that happens.
Yeah.
I didn't know what else to do, otherwise I wouldn't have phoned.
No, don't worry. How many times have you been sick today?
Just
that once.
BP's all right, mate.
Yeah.
130, systolic. Have you got pain at the moment?
In my chest and my abdomen a bit.
When we got there, she was in some quite severe pain and quite distressed. And doctors had advised before if she had any problems to return back to hospital. So we thought it was in the patient's best interest to go back to hospital.
Jump up there, mate, and we'll pop you on the bed.
Are you alright, Mum? Yeah.
Sit on there, mate. Swing your legs up.
Amy's mum is going with her in the ambulance, while baby Harley stays at home with her granddad.
All right, mate. Harley, you good to go?
Yeah.
Moving off.
Okay. You got your seatbelt. How are you feeling now?
A bit better. My pain's like a 1 at the minute, so I'm just more worried about the baby, to be honest.
I was just about to say, but you're more worried about the little one.
Yeah.
Look.
I know she's alright, it's just...
Yeah.
Okay. The baby.
You're not going a million miles away.
No. I'm just worried that they're going to tell me that I've got to stop in again.
Yeah. Amy was quite hesitant about going into hospital because she'd recently had a young baby. I am a mum myself, so, you know, it's a bit daunting if you don't know, obviously, what's going to happen. So with a bit of reassurance, she was quite happy to go. Thing is, if you go in now, you might be in a couple of days.
Yeah.
If you left it, you could be in there weeks.
Yeah, that's what happened. That's why I was in there weeks before.
When I had it, anything set mine off.
Yeah.
Have you had gallstones as well?
My nan did.
Yeah.
So they said it might be hereditary or something.
Yeah.
Come on. Come on, you go first.
Amy will be assessed by doctors, who will decide whether she requires surgery.
She seemed all right, didn't she? She'd obviously got gallstones. Whether it was just that causing her the pain.
Could be pancreatitis.
Pancreatitis, yeah.
Pancreatitis,
Well, they
so-
told her to come back, didn't they?
Yeah,
So,
I mean, she was more worried about leaving the baby behind, which she's going to be, isn't she, really?
she was all right though, wasn't she? She walked out.
Yeah.
But
Nice
it's-
young lady.
Nice family.
Yeah.
And their daughter had the same name as you.
As me.
Little Harley.
Even better.
Even better.
The late spring snow has returned to the West Midlands.
Hello. Hello, Scott. I
Scott.
actually recognise someone.
yeah.
V. Hodgkins is a mentor to student paramedics. Today she's working with a former trainee, Ollie Raven, who's now fully qualified.
Ah, there we go.
Category 3. Oh, it's 92. Oh, it's 92.
Says that he's fallen and says no injuries. But
92, that's a ripe old age.
it is,
isn't it? I think I might have been to this gent before and had to break into his house.
Dennis, their patient, lives on his own and has done for the past 12 years since his wife passed away. His carer, Julie, is waiting for the crew.
Hiya. How are we?
Dennis, they're in now.
He's been on the floor for more than 2 hours.
How we doing? Hello, Dennis.
Hello.
How are you doing? Not very well.
Yes, I met Dennis before.
My name's Ollie,
Yeah,
this is V, Dennis. What's happened, Dennis? His throat looks very dry.
Yeah, I'll just give us your pen, touch me. Open your mouth, Dennis.
How long have you been down here for? About 2 hours. Have you had a cough at all? You've had a bad chest?
Yeah, he looks quite unkempt compared to when I came last time.
Unwell.
Yeah.
What medications is he on? Have you got a list of them somewhere, or the pack or something?
Come here, young Dennis.
Dennis, we'll just do some checks on you.
I've been to Dennis before, so to go out to him this time was quite shocking. He was so thin, so much weight loss. You could hardly hear what he was saying. He was actually a very poorly man at that time.
Dennis, can I just have a feel of the back of your neck? Have you got any pain here at all? No. What about in your hips? Have you got any pain here? No. Dennis, I'm just going to have a listen to your breathing. Say yeah. Well, that sounds irregular.
Okay. I think Dennis needs to go in, do you, Olive?
I think so. I definitely think so. Dennis,
I like this.
I think we're going to have to pop you into hospital. You don't seem very well to us.
Dennis, if we thought that you were well enough to leave at home, we would. And I've left you at home before. We've met before, and I've left you at home. But today, yeah, things are a bit different.
It was sad to see Dennis the way he was. He had a lot going on. His blood pressure was low, his blood sugar was low. He needed to be taken to hospital.
Ready, steady, lift. Here we go, Dennis.
See you later, Dan. See you later.
Yeah, let's get you in the warm, Dennis. Got you, Dennis.
V and Ollie are giving Dennis intravenous fluids to bring up his low blood pressure.
Carlo, so this is saline.
Yeah.
400 ml. I did you a big one. All right, Dennis, we'll get going in a second. I'll get that heater on. Do you feel cold? Freezing? Yeah. Ollie's heart will warm you up, maybe, if you get to catch him on a good day.
Cold hands, warm heart, that's what they say about me.
Concerned about Dennis's condition, V and Ollie head off.
He's not a well man, this chap.
You still feeling okay, Dennis? Cold, I know, I know. We've got you wrapped up in blankets and the heating is coming on. Okay, it's warmer in hospital as well. All right.
It takes nearly 15 minutes to get to hospital.
Happy?
Yeah.
Dennis will be thoroughly examined to try and work out what has caused his extreme weight loss and fatigue.
Wasn't very well, was he, Dennis?
No, bless his cotton socks.
I think sadly something's going on there, isn't it? That's making him quite unwell. The carers were very concerned, weren't they?
Yeah.
Rapid loss of weight.
But he's now in hospital and he's being, you know, he's going to be nursed, isn't he? He's going to be nursed and cared for.
Comfortable,
so,
yeah. And to be fair to him, he's 92, isn't he? He's done well.
Well, we said on the way to the job, didn't we? What a grand old age
yeah,
that
well,
was.
exactly, yeah.
I think, for work, I think companies should provide us with our own snowmobiles when it snows. They're like the little things that you sit on, they're like jet skis, but on like skis.
Probably a bit more awkward when we hit the tarmac again.
Yeah, well, but there again, you could have tracks on them, like tank tracks.
Ambulance service fired for destroying roads.
It's Sunday lunchtime, and it's still snowy.
I'm tired.
No, don't yawn. Don't look, you're going to get me going.
Regular crewmates Tina Spittle and Donna Parcell are off to see a special patient.
Let's go off to our, one of our own.
They've been called to treat the father of a fellow paramedic with the West Midlands Ambulance Service.
Not that I give any better care, but it isn't one of those that you want to look after our own little family, sort of kind of thing, our Ambo family.
Tina and Donna have known the patient's son, Kevin, for 6 years.
He's at work today? He is, I've seen him earlier. There we go. I don't know which way to go now. I'm like,
Oh, that's grass, thanks.
Hello. Sorry, I've got about enough snow to bring in half the street. There we go. Where are we going, darling?
It's all right, yeah.
Upstairs. Oh, there we go.
Something smells good.
That smells Sunday dinner. That smells of a Sunday dinner to me. Hello, my darling.
Hello.
What do we call you, sweetheart?
They call me Bernie.
What's happened today, sweetheart?
My husband all night has been pounding away.
Pounding away, is it?
So
He's got this thing that's on his finger.
Oh, yeah. Okay.
And
it went to 129 at one time,
129.
but it keeps going up and down now.
An adult's normal resting heart rate is 60 to 100 beats per minute. Bernie's is significantly higher.
Do you suffer with your heart normally?
I'm on blood blockers and the tablets are up there on that box.
Okay, I'll have a quick look in a minute. And are you in bed because of this fluttering in your heart, or have you felt unwell?
Resting, because the doctor told me I was to rest.
So you felt your heart going pounding when you're lying flat?
Yeah.
So when you were in bed, it was going a bit crazy?
Fast.
Any pain when you've had that?
No pain.
Okay. Any heart attacks in the past?
No, they tested me when I was in there for a heart attack. I said it wasn't a heart attack I had.
Good. We're getting to your ankles, all right.
Found his son.
Yeah.
And he's found.
He's phoned us. That's all right. He can do that. We'll let him off. We've seen him today. Right. Can we do a few other checks? Just check your temperature. Are we allergic to anything?
Only to the boy.
Oh, well. You've had enough time to escape, I'm sure. I'm still here. Okay.
Right, I'm going to pop these dots on your chest to check your heart. Is that all right? Yeah, it's just to get a closer look. Have you still got that tightness now?
I don't it's in my chest, so I almost don't know. It was in my...
He's got an irregular heartbeat,
Yeah.
which we know about.
Yeah.
He's got a bundle branch block, but it's a right-sided one, which I'd guess is old for him. So nothing jumping out too much. Bernie had a complex cardiac condition, which included a right bundle branch block. This is an electrical issue in the heart. He's lived with this condition for some time. However, the new episode of chest tightness today was of concern to both of us. Just have a listen to his chest as well, if he's saying that he's got this tightness.
Just nice, deep breaths if you can. Lovely, oh, that's a good one. Chest sounds clear.
Have you ever been told that you've got angina?
Yeah, he has got angina.
Well, he mentioned it at the hospital, but I never said exactly.
Right, okay.
Still under blood pressure.
That doctor at the hospital, he gave me one of these white sprays.
That's it.
Oh, yeah.
GTN spray is medication given to patients who suffer with angina. The spray helps relax the chest muscles, and it could be just the thing to help Bernie.
If you have this pressure, so like you described earlier, you said in the middle of the night you felt like there was a bit of a tightening.
Yeah.
Then give yourself one spray, wait 15 minutes, and then have another. After those 2 sprays, if there's no improvement, you get us out. I'll tell you where we are with everything. Your heart trace, okay, that we've done, is showing damage, okay, but it's showing damage that predominantly is old. There's nothing showing that it's a problem today. However, I can't give you 100% guarantee that everything is okay. On that basis, our recommendation is always, if you have chest pain, you go into hospital. Are you happy for that to happen, or do you want to stay here?
I'll stay here, because I know chest pains about like.
You've had this squeezing, that's my only concern. Yeah. And that can be interpreted as a pain. So that's why our recommendation is always that you go up to hospital. Okay? But again, I can't force you to go.
I feel better than I was.
We can walk out this door now, and if in a minute's time that you feel unwell again, you can call us back.
Yeah.
You know,
there is that option.
Don't bother with your son. Call us.
Yes. Did Kevin say he was going to come up, or is he stuck on a job?
He's stuck on a job, so.
Okay. Where is it at? Oh, here it is. Will that be Kevin? Hello? Hello, my lovely. Tina? Hello? I'm here. Hello. Do you want an update? Have explained to him that because he's had some kind of chest tightness, you know, our advice is automatically going to be casualty. No. How did you know that? Anyway, I'll pass you over to Mom. All right then, my lovely. See you later. There you go.
All right.
Oh, bless him.
Hang on a minute. Is it just Tina that's excellent, not me?
Say yes.
Yeah.
Yes, it's just Tina.
The cheek.
And Bal. Bal's excellent.
Oh, bless him.
Ta-ra. He says you're excellent, so.
Oh, bless him.
Just Tina.
Yeah, just me. What can I say? I'm amazing.
You wait. Yeah.
With Bernie not wanting to go to hospital, it's time for the ambulance team to say goodbye.
Right then, in the nicest possible way. We don't want to see you again. All right, darling, you take care.
Bye-bye.
Donna, did you hear? I am amazing.
No, I didn't hear anything, any words of the sort. I think you're lying.
I think now I heard distinctly.
No.
Tina
I didn't
is
hear anything.
amazing.
Did not hear it.
That's what I'm going to go with. I feel like I should write that on my CV now.
Yeah, whatever.
Yeah.
Not listening.
Incredibly, the man who had suffered a cardiac arrest at the wheel of his car is doing well. In hospital, he was put into an induced coma for 5 days to allow his body to recover. He stayed a further 18 days before being discharged. He's now back at home and is still very weak, but should make a full recovery. Mary was diagnosed with pneumonia in both lungs and a urine infection. She stayed in hospital for 3 weeks. She's now at home being cared for by her husband Sam, now with extra support from regular carers. New mum Amy, who was suffering from gallstone pain, didn't stay long in hospital. However, she's since had surgery, and the stones were so large they had to remove her entire gallbladder. She's recovering well from her operation. "92-year-old Dennis spent 10 days in hospital to build up his strength. He's still very weak and is being visited more regularly by carers at home. Bernie, whose son works for the West Midlands Ambulance Service, went to hospital the following day to have his heart checked out. He was diagnosed with a respiratory tract infection and given antibiotics and steroids. He's not had any problems since.
I guess that's the beauty of this job. You never quite know what you're going to get.
Let's step into the world of medical emergencies and paramedics as we go inside the ambulance at Christmas next.